So much. The measles outbreak here in Texas has now grown to 309 cases. Of those, more than 230 are in patients under the age of 18. The outbreak also hospitalized at least 40 people at this point, according to the latest update from the Texas Department of State Health Services. This afternoon, we are joined by Stephen Simpson with the Texas Tribune. Stephen, thanks so much for joining us. We always appreciate that.
Thank you for having me.
So today you put out an article that looked into how the Lone Star State could be setting the stage for what could become a nationwide epidemic. What are some of those signs pointing to that?
Well, some of the easy signs to see is the amount of cases and the number in counties involved. Like you said a little bit earlier, there's already been 300 cases, and I think we have nearly 14 counties have already reported measles cases in a span of 50 days. The CDC reported last year Chicago had a measles outbreak with only 64 cases. Also, health officials in Oklahoma and New Mexico have reported measles cases that specifically track back to Gaines County, which shows it's pretty much an out of control spread.
And I know that hearing that, people might be alarmed by it for sure. So what are some of the factors that you've seen that could be contributing to the speed at which the measles is spreading?
There's several different things kind of all playing together at once. There's a lack of people getting the vaccine despite measles being present in the community. And another is people aren't following the voluntary quarantine. There are reports of people traveling while having measles or having family and friends over. And from what I've heard is measles is so contagious, if you walk into a room of 10 people with it, more than likely 9 people will get it. Another thing is the amount of vaccine exemptions we have here in Texas. So it can spread like wildfire if it makes an impact into one of those communities, kind of like what we're seeing in Gaines County.
Yeah, you touched on it there, but I'm hoping that you can talk a little bit more about what health experts are suggesting about the things that we can do to try to rein in that spread.
Well, the first and foremost important thing I've heard is we got to get the vaccines out there. For Chicago, the way they controlled their measles outbreak is they administered over 30,000 doses of the vaccine. That is something that we would have to do by exorbitant numbers, which is a challenge that we're seeing right now. We also got to say, as experts say, change the views on public health, just in general, like from taking vaccine suggestions to quarantine suggestions, from recommendations. It seems like it's become a battle with each and every one of these things. And if we're going to have to change that to control these kind of diseases.
Well, Stephen, the article that's up on Texas Tribune's website right now is definitely worth a read, so hopefully everybody out there will check it out. But for now, Stephen Simpson with the Texas Tribune, thanks again for joining us this afternoon. We appreciate it.
Thank you guys again.
Coming up, a fire